Live from the Washington, D.C. area, it's the Inside Scoop, EmeraldPlanet. All the ecology news that our viewers want to know. Now, here's your host, Executive Director of the EmeraldPlanet, Dr. Sam Lee Hancock.
Hello, I'm Dr. Sam Hancock of EmeraldPlanet in Washington, D.C. as we come to you around the globe looking at 143 different nations, looking for the 1,000 best practices that are making a difference as we move through the 21st century. And so we're looking primarily at the technologies, the services, and the products, but also the programs and the people that are making a difference as we move to a planet that will have 9 billion souls. So how we're going to take care of these people, but at the same time to enhance and increase the quality of life. What we're talking about is green medicine. Many people say, well, what's green medicine? And this is something that's been around as far as recorded history at least 6,000 years, and probably goes back even earlier than that as far as the archaeological studies and digs that have been going on around the globe. But we have two people sitting with me that actually are coming out of that tradition, and so something that's very old has become very new. So I have Rose Hong, who is the managing partner, and Dr. Owen Liao, who is a PhD and medical director and managing partner of what's called Whole Health Medical Centers of New York and Washington, D.C. So Rose and Dr. Liao, welcome.
Thank you. Nice to be here.
Glad to have you here. Rose, tell us a little bit about the Whole Health Medical Centers. And it's really fascinating in reading your background that you've designed over 40 facilities that are LEED certified, and we're talking about very traditional medicine.
Yeah, absolutely.
It's amazing.
Well, you know, in the past over 10 years, I've been active in the healthcare industry. I've traveled overseas for medical missions, and domestically, I travel across the country and building healthcare facilities. And also, of course, the green hospital facilities is very new. I just started in the past few years.
Let me cut you off for 1 second. Let's bring up the first slide so we'll have some photographs going about this. So if we can go to the first slide, it would be great. Rose, go ahead.
And during this travel, what I discovered is throughout the nation, and we have, of course, lots of primary care and community-based medical centers. However, we do not have many alternative medicine facilities.
And this is something that's really interesting because we were talking before we came on, and also with Dr. Liao, about how that the alternative medicine is really very important, and it's actually becoming the leading edge as far as what's going on. So how did that relate of noticing we didn't have this alternative care lead to your organization?
Well, you're absolutely right. And as you know, in our nation, 1 in 2 adults have one type of chronic condition. And so that translates to 133 million people in the U.S. suffering from one or more chronic conditions. And chronic condition, if you use conventional treatment, primarily rely on medications, prescription medicines, and also surgery. And so we are seeking alternative, cheaper, as you mentioned, cheaper, but more effective, less invasive treatment methods to treat our patients.
It's cheaper, we'll say less expensive.
Less expensive
there you go.
And less invasive method to treat them. And that's one of the reasons I created a Whole House Medical Center, which is community-based and also integrate both traditional medicine, alternative medicine primarily based on Chinese medicine, acupuncture, herbal medicine, with Western medicine. I think that's probably the best of the two worlds to achieve better health care.
Dr. Liao, why do you think there's been such an explosion of interest as far as alternative health care is considered? And we're using the term TCM, traditional Chinese medicine, but we know the Japanese, the Koreans, the Indians, the Vietnamese, the Laotians, all these people have been at it for a long time. So why do you think there's this sudden probably the last 20 to 30 years. It's not really sudden, but it's been coming, and now it's really moving at a very rapid rate.
Well, you know, the traditional mainstream medicine has been very good about getting people's idea that they can help for acute condition, for supporting the life. But in dealing with the real health, they are really well behind the traditional medicine, because the traditional alternative medicine has been with the human for 6,000 years, as you just said. And through that 6,000 years, the medicine has been purified, has been testified, has been producing a lot of positive results. And they can not only deal with the symptoms of the condition, but also dealing with the root cause of it.
I think this is something, Dr. Liao, and Rose will come back to the next question for you, but I think this is something that's really very important. You're doing it in a holistic manner.
That's right.
It's the balance of the mind, the body, and the spirit. And this is something that Western medicine is not good at, is having this balance between all three. Why do you think alternative medicine actually started with that balance?
Well, it is the model behind the nature, basically. We call it Tao in Chinese culture, okay? And you think about that, when in Western medicine, when someone has a mental condition, the doctor will send this person to a psychologist doctor or psychiatrist, not other doctors. But in Chinese medicine, all the psychological conditions, emotional conditions are part of your physical, actually. Mm-hmm. For instance, I treat a lot of anxiety people. Their main condition is in the center of the line of their body. So that's where you have to strengthen their body, strength energy. And so that once that is done, it translates into their mind. Oh, I didn't know I can be so peaceful today.
Well, and that's something very important. And Rose, this really goes to what we were going to talk about, is that using of diet, daily physical exercise, and also the various prevention techniques. And this is something that it's almost like with the Western medicine, it's an illness type of medicine, where the other is preventive, and again, going back to this holistic. How do you balance those three, and how do you actually engage people so that they want to have proper diet, regular exercise, and really not even get sick?
Yeah, well, this is actually where the major differences between conventional medicine and alternative medicine is. Conventional medicine, as Dr. Owen described, treats very specific conditions. We call it crisis management medicine. So we're becoming very specialized. When you have a medical condition, you go to see a family doctor, physician first, and then he or she will refer you to a specialist. More likely, you will see more than one specialist. Each specialist look at a very specific condition or body part where you have problem. However, versus alternative medicine, we treat you as a whole body, mind, spirit, all interconnected. And for that reason, when you go to see a Chinese doctor, alternative medicine doctor, and we encourage you to look at your entire picture. Look at the exercise, your nutrition, your diet. And exercise, for instance, I think is probably the least prescribed medicine.
Well, really what you're looking at is that you're looking at the whole person, and this is something as what you're doing, and this goes back to Dr. Liao's statement. You're engaging the mind, you're engaging the body, you're engaging the spirit, in order to create a healing environment as far as the individual is concerned, correct?
You're absolutely right. Now, when we say ecology, when we talk about the nature,
ecology
is the term. If one thing goes wrong, there's a chain reaction. Everything is interrelated, impact each other. Same with our body. Our body is a whole system by itself. Not only by itself, we're interrelated with nature. So if one thing goes wrong, other parts of the body will be impacted as well. That's why Chinese medicine, when you come to see a holistic doctor, will prescribe, of course, your body, mind, and spirit. And truly, it's your whole body.
Yeah, and that's really looking at it as a whole system. And I think that's what's very important. Instead of just, taking each discrete part and saying, this may be your part, but over here, never know how the interconnectedness is going to be. So Dr. Liao, why are we calling this green medicine, and how do you see this expanding around the globe as we move through the 21st century?
Yeah, just like what I mentioned before, green medicine is nothing but doing everything along with the nature. What nature offers to us is also what nature gives us the environment as well. Nature gives the sun to us, but nature also gives us the wind, severe winter, and that makes you sick sometimes. So by knowing that the nature gives us both sides, if you know how to deal with it, that's better, right? That will save you a lot of money just by knowing how to prevent trouble from, or how to absorb energy from the nature. Right.
Well, looking at the, going back to the concept of yin and yang, light and dark, male,
right.
female, and all that, how does that play out in what you're doing as far as your wellness centers?
It's extremely important. I give you an example that I deal with a lot of people with the body, that their upper body is very hot and their lower body is very cold. So that their yang is going up and their yin is all the way down, and they don't talk. And you want the earth, although you have a summer and winter, but you want them to be taking turns. But this hot body and cold limbs, they never exchange. Not like a summer, you know, in the day you go up there, and
so
night
you're not getting the right circulation of air and blood.
Exactly.
Okay.
So that's actually one of the main causes of diabetes. Okay.
That is a very interesting point, because you know that's a real scourge that's going on in the United States. And it's an epidemic as far as diabetes, both type 1 and type 2.
And it's getting more and more.
Yeah. And Rose, how can Western medicine coexist with this alternative traditional medicines that we know goes back at least 6,000 years and maybe even longer than that?
I would say we must, for quite a few good reasons.
I like that attitude. We must do this. Okay.
First of all, of course, talking about the quality of care and the effectiveness of treating those chronic conditions. You know, we look at a number, 133 million in the nation. That's a huge number. How can we treat those patients effectively, improve the quality of life? We're successful in extending the life, you know, from 44 now to 80. However, what is the quality of life? So you have to improve our quality of care. Alternative medicine is able to address all these issues through nutrition, proper food, proper lifestyle adaptations, changes, diet, exercise, to achieve this very less expensively, less costly than conventional medicine. That's one. And secondly, when we talk about...
We have about 15 seconds, and we got to wrap up.
And the two, of course, we're looking at the national financial crisis, and we must adopt other methodology to reduce our health costs in this nation.
Well, looking at what we're doing, anyway, it's very, very important that we work together as far as the alternative medicine is concerned. And it's really critical that we actually improve as we create the Emerald Planet.
Some dreams are universal. Dreams that inspire us. Multiple sclerosis is a devastating disease that changes lives forever. The National MS Society does more for people with MS than any organization in the world. But we can't do it alone. To get involved, visit us online at nationalmssociety.org or call 1-800-FIGHT-MS. This is why we're here. Because nobody dreams of having multiple sclerosis.
What's wrong with this picture? Half of young Americans can't locate economic powers like Japan and India. 20% can't even find the Pacific Ocean. Without geography, our children aren't ready for the world. Geography is everywhere. It's incredible creatures, rhythm, fashion, flavor. It's economics and politics. It's change. Understanding connections between people and places is critical in the 21st century. That's why we created mywonderfulworld.org. Go there now for your free parent and teacher action kits and give our kids the power of global knowledge. Because kids who understand our world today can succeed in it tomorrow.
to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe in 143 different nations looking for the 1,000 best practices, the technologies, the services, the products, and the people that are making a difference as we move through the 21st century. One of those areas as the planet urbanizes to where more than 70% of the world's population will be living in cities and urban areas by 2050 is how we're going to provide the basic infrastructure and the health care that they need. A gentleman who's with me in this particular segment has been at this for well over 40 years around the globe, looking at how do we take the principles of modern medicine and also using traditional medicines to bring about an increased quality of health care and not less as we expand the population. This is Dr. Juan, known as ASTOC Montero. He's the president of Montero Medical Missions, and ASTOC, I'm going to call you that. It's good to have you back with us.
Well, thank you. Appreciate it.
It's been too long since we've seen you. Tell us a little bit about the Montero Medical Missions as it's the outgrowth of the Doctors for Peace.
Well, Physicians for Peace. Yes, indeed. What, 7 years ago when we were here? And I was then with Physicians for Peace. As you know, I'd been doing mission work in the Philippines specifically since 1981. And then the founder of Physicians for Peace, the late Dr. Charles Horton, and I were then we then had this dream that one day we would like to get as many expatriate physicians in this country to go back home to give back to their homelands.
And when you say expatriates, we're talking about people like yourself from the Philippines,
yes,
or India, China,
exactly.
Malaysia, doesn't matter, whatever country they came from,
exactly.
Here, settled, have their
yes.
families. Now it's give back time.
Exactly, because many of my contemporaries are either dead, dying, retired, retiring, or at the height of their influences in the respective regions of the country. And my dream with Dr. Horton then was to reverse the brain drain that occurred in the 60s and 70s when many of us, my contemporaries, came here. America opened its door and we had a red carpet welcome. You know, we trained and many of us went back home. I happened to stay here because of circumstances beyond my control. And now it's time to give back. And so that's what I'm doing. That's why we're trying to specifically recruit these doctors and allied health professionals to give back to their homelands.
Well, this really leads us to the next issue, and many people say, well, why should we care about, countries abroad? Why not focus within our own local communities? Because there's huge needs that we have here. But at the same time, the United States actually benefited from millions of people that came here. Yes, they studied, they used the educational resources, but they stayed, they practiced their craft in the medical arts. And really, it's almost time for the United States, even though we've been doing it, to give even more back to the world.
Yes. Well, we are very fortunate. Personally, I've been very fortunate to give back to Uncle Sam, I would say, since the 80s, when we put together a free clinic in Chesapeake, the Chesapeake Care Free Clinic, which is now the most comprehensive free clinic in the nation, for the, if not the most comprehensive, close to the most comprehensive, because we have both a dental, medical, surgical work up there for patients that may need that kind of care.
And now, what you're talking about is the veterans, and these could be either retired or active duty, but members of the armed forces.
Correct. For the Montero Medical Missions, that one that I described to you was when I was still with Physicians for Peace. The Montero Medical Missions is now focused on in-country mission work. That's why the MMM Health Fair for Veterans is a unique in-country project, and we just finished our second event yesterday, and we screened about 60 veterans and in their healthcare needs and help them out get to the right proper specialists.
Well, I think this is something that I understand you're going to be doing on a quarterly basis, but let's go back to the international, because you were involved in the Philippines, but you've also done some work in the Middle East and many other countries, and I was talking with the Physicians for Peace, and I know that they're now in over 30 countries, and you still collaborate with them. So looking at what you did over all these many years, because you were full-time here, but you were actually going overseas on a very regular basis. Tell us about that and what drove you to do that, not just the give back, but what is in those areas that made it very important and may have translated into improving the services you're providing here in the United States.
Well, it is so priceless, because every country I go to, every mission work I'm involved with, I always learn something. And with that, then I could expand more ways of giving back. And this is being received so well by my colleagues, contemporaries, and now even if the Montero Medical Missions is only 18-month old, we have already touched base with so many stakeholders, supposedly, you know, and everybody is always volunteering. It's so easy to recruit, even for to be in our advisory board.
Well, being 40 years in all the activity that you're doing, that really what leads to this springboard of the base of people wanting to be involved. And I think that's something that's very critical, and we're not going to let you forget how many years you've been doing this as the young man that you are. But how do you make the selection over those years of what countries you would go into, and maybe what focus would be as far as, you know, the dental, the eye care, surgery, and all these other things? How do you make those decisions, and then how do you compose the physicians and also the medical assistants that would be part of the team?
The key element is the funding. Anybody with a minimum of $5,000 right now, we can create a mission wherever, anywhere in the world, from minimum of $5,000 to a maximum of whatever it is, depending on the size of the mission team. Yes, I am very fortunate that I have so many associates throughout the country that I know of through the American College of Surgeons, through the American Medical Association, and of course in my community of the Philippine physicians and surgeons. And I can recruit volunteers overnight.
Yeah, well, I tell you, it's just really fantastic, and it's the years of experience, but also it's the enthusiasm and the commitment to change and to providing services in the area. So we're looking at national governments are supposedly in many countries, not so much in the United States, many countries are really responsible for broad-based health care. They're to take care of all the primary and public health care needs. But yet at the same time, there's tremendous demands to have these medical missions that you've been heading up and all over the globe. Why does it continue that national governments are responsible for the health care, but yet you still need to have expanding numbers of these medical missions?
It's priceless. The welcome, the smiles of people that we help, you can put a price on that. See, MMM is committed to promoting world friendship through the universal language of the healing arts.
I love that statement. I saw that you shared with me just a couple of days ago. But why do you think that it's still a need for these medical missions and national governments are not providing that same direct care?
Well, of course, healthcare is expensive, as you know. And especially in third world and developing countries, it will always be a problem. And our population is growing leaps and bounds.
Yeah, we're going from 7 billion souls to 9 billion souls by 2050. So that's 2 billion new people we're going to have on the planet. So what you're saying is, Dr. Montero, is that we're going to need more medical missions, not less.
Absolutely.
So how do you think that we're going to be able to continue to expand doing these medical missions when there's more and more pressures, not just the United States, but throughout Western Europe, Japan, many other countries are going through the same constraints because the populations are aging.
Correct.
And so there's more need for medical care. How do you think we're going to balance that? What's going to happen?
It's difficult, but this country is known all over the world as the most giving, one of the most, if not the most giving country in the world. And we just found a niche here to propagate that American influence throughout the world. Who could be better ambassadors for Uncle Sam than people like me going back to the Philippines, people like Rose going back to China, people, you know,
whatever national origin they come out
exactly.
of, let them go back, help
exactly.
their people. And as now we're over 300 million in the United States, it's the third most populous country, you really do have a broad-based population, particularly with the baby boomers.
That's right.
And now that they have an opportunity, maybe for the first time in their life, to give back
exactly.
and to do it abroad.
Exactly, exactly. We're very fortunate. Again, this thing with the veterans, I tell you, anytime I mention this health fair project that we have, everybody writes away, how can I help? How can I be part of this? It, again, yesterday showed so much enthusiasm of everybody. We're very fortunate to have our new state health commissioner of the Commonwealth of Virginia to be there. She energized everybody, her tone of enthusiasm.
Well, when you have people like that, officials that are coming from whether it's the local, state, or federal government, it really does energize people and motivates them. We have about 1 minute left. So looking at, you're an approved 501c3, which is recognized by the Internal Revenue Service of the United States. How are you able to fund yourself? It's got to be quick.
Okay, 18-month-old humanitarian organization. We don't have any paid employee yet because we don't have any money. Hopefully, sometime the end of the week, we can interview this lady to get us started on.
But how do you find the funding?
Through grants, through my contacts and my board contacts.
And so what you're doing is then you're drawing on these vast resources, 40+ years of being in the profession,
yes, sir.
And very much involved. So looking at the last question, what do you see? We have 30 seconds. What do you see for the future of medical missions abroad?
It will be needed a whole lot more, and we just have to find the supply, how we could respond to that need.
And so these are pharmaceuticals, it's techniques, yes. It's medical equipment, exactly. And the personnel, all those involved.
Exactly.
Well, Dr. Juan Ace Doc Montero, who is the president of Montero Medical Missions, thank you for being with us. And it's just really fantastic, the enthusiasm and the way that you can actually bring these resources together to bear, because it really takes everything. It takes the facilities, the people, the medicines, and the equipment. And very important. And thank you for being with us as we look around the globe to create the Emerald Planet.
I helped turn my child's public school into a whole new kind of school. One with a curriculum that really motivates kids. One that has extended hours, 6 days a week, year-round. With loads of academic, cultural, and recreational activities. One that has support services like medical and dental right there. A school where parents' involvement is encouraged. Where teachers have more time to teach. And students are excited about learning. There's just one problem. My child doesn't ever want to come home. You can help turn your school into a community school for excellence. Find out how. Call 1-877-LOVE-TO-LEARN.
It's coming. Right to your neighborhood. And when it does, you may be surprised. It's your Social Security statement of your benefits, and it's going to help you plan your financial future. Your benefit statement will tell you how much Social Security you're eligible to receive and when you'll get it. Then you'll know how much you need to save for retirement, because that's coming too. The future is in your hands. Choose to save.
The toxic fumes from this meth lab are seeping into Jamie's sinus cavity. Ammonia vapors invade her throat. Toxic gases fill her lungs. Jamie's body is deteriorating. And she doesn't even know it.
Jamie, dinner.
So, who has the drug problem now? Find out how meth affects you at drugfree.org/.
to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe for the 133 countries that we're dealing with and looking for the 1,000 best practices, the technologies, the services, and the products that are making a difference as we do move through the 21st century. And so we're always looking for new technologies that are making a difference. And the gentleman that we're interviewing now is absolutely not just the leading edge of technologies, but the bleeding edge of technologies and moving beyond the horizon. It's just really fantastic what Rick Cochran, who is the president and CEO of the Mobile Medical International Corporation. That's a long title, Rick, but great name. And the work that you're doing is just absolutely incredible. I went through everything that you're doing, and it's just phenomenal.
Well, thank you. It's been a delightful project. It's something that I started many, many years ago with the hope to make a positive difference around the world, and we're doing exactly that. It's been quite an exciting project.
Well, I have a chance to go and visit with the President of the United States and be recognized as the National SBA Businessman of the Year. That's pretty impressive.
It was a unique honor and a privilege to meet the President, certainly to be recognized as the SBA Small Business Person of the Year out of all the states in the United States. I thought that was quite amazing.
Well, it's absolutely incredible. We're going to move up here to this big tractor trailer here and all you're doing, but tell us about the origin of MMIC.
Yeah, I started in the healthcare field many years ago. In 1980, Congress passed the Healthcare Reform Act that essentially allowed some competition in the healthcare field for the U.S., where physicians could go out and begin their own ambulatory surgery centers. And so in those early days, and I kind of grew up in the healthcare world and setting up surgery centers around the United States, but doctors wanted an opportunity to have their own facility. And I said, what if we could take a group of physicians in a geographically dispersed area and combine them in some kind of a unique way, but using mobile technology? And so I started down that path. And in early days, people would laugh, saying, like, you'll ever be doing surgery in the back of a truck. And I said, but don't think of it as a truck. Think of it as a healthcare facility, designed as a healthcare facility, albeit on wheels.
Well, looking at what you're doing, I know that you're actually expanding around the globe in many different ways. You're working with the military, also commercial, I guess we can say that, as far as healthcare. Many people like to think of their hospitals and health clinics not as a business, but it's a huge business.
Well, it is. There's activities happening around the globe where healthcare is such a major part of our economy, part of most economies. They have major needs. And how do you do that? How do you deliver that care? And it has to be done in a different delivery system. We need to look at the way that's done. In fact, 2 years ago, I was on a panel that evaluated kind of how we deliver care here in the U.S. and saying, you cannot continue to do what you're doing today. What if 50% of all our cases were done outside the hospital environment? How would your model look like? And I think we're seeing more of that.
Well, just looking at this, we have this airplane coming here, and people saying, what does this airplane have to do with what Rick is doing as far as his mobile medical centers? But yet when you look at it, the airplane is the hospital.
Well, that's right. The airplane, which is the Project Orbis, a nonprofit entity that goes around the world training physicians how to do surgery, providing free care. One of the problems they have, this is now their second generation airplane that they're on currently, and when they went to install, say, a monitor or something very simple, a $5,000 monitor might be a $500,000 expense because of all the FAA guidelines. So what they said is, what if we could modularize the solution and literally roll on, roll off these systems onto the airplane? When it lands, then it becomes the surgical facility, but otherwise we're just a freighter and we're hauling it. And Mobile Medical today is building those modules that will be used by Orbis in the near term.
I tell you, I just think it's fantastic. I'm just moving forward through these. We usually just have these as a backdrop, but it's so interesting what you're doing that you really just get drawn into this. So what are we looking at in this next slide, and what's happening here?
Well, what really is happening in these slides is that you're seeing the layout and the configuration. So from a modular perspective, you could roll on, in this case, a flying eye hospital. The U.S. Air Force, however, may look at it and say, you know, we need something commercially off the shelf that's available, and now we have that. No one has ever built what we have now constructed for this flying eye hospital. So you could put these modules onto an airplane, on a KC-10, on other aircraft, fly them anywhere around the world, offload them, and have instantaneous care.
Well, looking at this, so if you had a tsunami or you have an earthquake, any kind of natural or man-made disaster, because more and more of these things we keep saying are acts of God, really it's man is creating this because we're denuding, you know, all the trees from the forest. We're not properly interacting with the rivers, the sea coast, and all that. And what you're doing is you're trying to leapfrog over the mistakes that we're making as human society and responding to these needs even before people know that they need it.
Well, I hope that we'll find an opportunity, because there continues to be challenges around the world. There will always be disasters and needs. I know from a responsible point of view, we look at our technology. It's more fuel efficient. We look at things that are cleaner, using new technology, always trying to make a difference in the world.
Now, looking at these, now this is something that actually I've told about 10 different people about this already. I like this, the boat, the ship concept. So what are we looking at here, and how does that complement the air and the ro-ro, the roll-on, roll-off, as far as the containers are concerned?
We've got a variety of product sets, and it happens that this particular one is the Lake Tanganyika Floating Clinic. It's a very unique, it's one of the largest lakes in the world. It's in Central Africa, next to Tanzania. And what's interesting is there's no access to the water. So this unit is going to be built and fabricated, all collapsed, shipped in, and then rebuilt at the lake. And so it's going to what it will do is provide care for about 3 million people that don't have care today.
That's just absolutely amazing. And looking at this too, and let's go to the green jobs. This is something that we really talk about in EmeraldPlanet, and actually we are involved in a number of not only just the issues, but projects here in the United States and abroad. So looking at this, how many people then in those local communities that can actually get involved, learn the skills, so you're expanding the brain trust within that area, but also they're becoming familiar with healthcare from around the globe right in their own local communities.
That's right. I think what we try to do is we try to make sure we train up the people. There's always a series of job developments that come, and job creation anywhere we go. You've got your service techs, you've got all your support personnel, your nursing, your physicians, but also from the green technology, this project with Lake Tanganyika will use solar and fuel-efficient systems. It's all about being green as far as that goes.
Now, looking at the efficiency of this as far as bringing people on, so you're actually floating this, so you're not having to go out and find the land to take land out of, say, agricultural production. So looking at this, what the implications for this around the globe, because there's so many nations that actually have long coastlines, or they have internal lakes where they could actually use something like this.
Yeah, I think what makes our project unique is that the truck-mounted units, the military models, the ship, the airplane, they meet U.S. standards of care. One thing that we see...
Let's say that again. I think this is a critical point.
Well, I think what happens is often people say, well, third world countries, it doesn't matter what you provide. In our case, we're saying we want to meet U.S. standards of care. To the extent possible, we provide airflow filtration systems, we provide all of the sterile environments so that they get the same care, whether it's in Tanganyika, whether it's in Oman, anywhere in the world, it's the same care as what you'd get in the U.S.
Well, I think this is something that's really important, Rick, and you and I were talking about this before we came on, is that the level of care as we move to 9 billion, we're at 7 billion people now, we're moving to 9 billion, right. And it's not the fact that we just make do for this 2 billion, but the fact is that we need to actually enhance the quality of care and the quality of service for these people.
I think as people grow in the world and become more aware as their cultures and economies develop, they demand higher quality, and that's one thing that we absolutely insist on our side, is that we continue to keep that discriminator, that high quality standard.
Now, looking at this, this looks like you have several containers that are joined here, or How does this all work as far as these mobile units?
Yeah, in this particular case, it's a military type model, or it can be used for rural outreach and more rural terrain. But it literally is an ISO box. You push a button, it expands out. It has an integrated generator, air conditioning system, all the lighting systems. So literally it can be an operating room, it can be an ICU, it can be a command and control center, whatever you wish it to be, but it's easy to move, it's easy to get in, it's robust for rural or military contingency type missions.
And this is something that even in the United States, we're talking about downsizing as far as facilities are concerned, but in these rural areas and now the expanding inner city areas, actually something like this is very applicable.
Yeah, we've run into a couple of cases. Even we did a project with a mobile breast care unit where it's really the underserved is what the term is throughout the U.S. And people are trying to find solutions to that.
Well, and underserved in the world is, you know, it goes without saying. But looking at this looks like something you'll find on Mars or something like that. And you were describing really how this works, but just walk us through how this thing would actually telescope out and then become a real unit.
Right. In this particular case, this shelter system is a mobile single pallet unit, and it takes about 7 to 10 minutes to set up. And when it sets up, it's an air beam technology. You simply roll it out, and all the lights, the electrical drops, the liner, all your air conditioning systems, everything is in play. We've used these with the U.S. Navy doing some missions in the Pacific. Oman has these. But literally, the generator, the air conditioning system is built in. You push a button, it's that simple.
I'm going back and forth between these two. I just love the juxtaposition of this, because you have this, and it literally looks like something you would see on Mars or walking around up there. And this is something here that's actually happening right now. So we're just about running out of time, and we're going to end up with this photograph. What do you see as far as MMIC for the future, but this type of mobile medical technology in the future? And you have about 30 seconds.
Okay. No, I think mobile medical has a bright future. We have quite a variety of platforms. We continue to integrate for the specific country. Largely, we work with countries and governmental officials. That's where we see our expertise, and we can solve their precise needs and solve their problems.
Well, I think it's just absolutely fantastic. Rick Cochran, who is the President CEO of Mobile Medical International Corporation. I just think it's absolutely fantastic what you're doing, and really the way that you're integrating technologies and making it very simple. I like your analogy. You push the button and you have almost an instant operating theater or a hospital, and that's something that we need as we look around the globe to create the Emerald Planet.
This is firstgov.gov, where we're obsessed with getting you government information.
Brand new student loan applications on the site, baby. This calls for a celebration. Where's your uncle?
So in the end, it was either take the astronaut gig or come work here. What can I say? Duty called.
Dude, that's my cop.
Oh, sorry.
Yeah. No, I'm pretty sure that's Sam's cop.
Oh, sorry.
Yeah. No. Sam's. No.
Just log on or email us and get what you need.
C, change of address form. That's how it's done.
D, driver's license renewal.
E, emailing social security information.
Yeah.
Okay.
Yeah. Nice, we'll allow it. All right, Ed.
What are those?
Government surplus cars for auction.
You posted those online last time.
No, you did.
I'm posting them online this time!
For all your government information, firstgov.gov.
Oh, what have we got here? Sometimes you feel tired. You can't seem to lose those extra pounds off your midsection. And your joints hurt when you take the stairs. Well, you're getting older. But I'm happy to say that there's some simple things we can do to keep you happy and healthy for years to come. We can also lower your risk for some serious diseases the older population is often subject to. Proper nutrition is more important than ever. Your body has changed, you know. Not as many treats. A basic exercise plan, lots of walks and fresh air, and most importantly, come and see me for twice-yearly checkups to help ensure the best possible quality of life. Now, how does that sound? Good boy.
Improve the quality of life for your elderly pet. Schedule twice-yearly checkups that include preventive care and regular lab work. A message from the veterinary members of the American Animal Hospital Association.
we're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States. I'm the President, Executive Director, and we're looking around the globe in 143 different nations, looking for the 1,000 best practices, the technologies, the products, and the services that are going to take us through the 21st century, but in a way that we're actually enhancing the care and concern and infrastructure for humankind as we rapidly urbanize to over 70% of the people in the globe will be living in urban areas, and also we're adding 2 billion new people by 2050. So as the climate changes, the earth becomes hotter, drier, how are we really going to balance all of this? And so we have 3 experts that are with us that are talking about this as we reach way back, almost 6,000 years as far as archaeology is concerned and recorded history on alternative and non-traditional medicines. But at the same time, we have a gentleman sitting right in the middle of us that's on the vanguard as far as taking us in real technological advances. So it's just fantastic, the balance that we have here. And we have a young man all the way over on the end is Dr. Juan Montero. Rick Cochran is here as far as his MMIC, and he'll tell us about that. And then we have sitting beside me Rose Hong, who is going to talk about their medical centers and how they're using alternative medicine. So ASTOC, as I call you, how do you see the future as far as medical missions, but the expansion of enhancing medical care for people as we move to another 2 billion folks?
This is indeed a tremendous project that I'm so glad that Rick is here. As you know, I just got to meet him an hour ago, and this is going to be the future of medical missions all over the world. It can be, we don't have to have the hospital situation. We can do operations in this unit with sterility, and that 90 or even 100% of what we do in medical missions are through ambulatory surgery, really.
Well, I think, Rick, you've become an instant hit because if ASTOC likes you, a lot of other people are going to like you as well. And it's really phenomenal because we're going to be moving shortly to Rose and what she's doing as far as her holistic healthcare units. But you're taking this very classical, this TCM, traditional Chinese medicine, but you're applying all the modern informatics, computers. You have a national award in that. I looked that up, and through the Smithsonian. So how do you see this balance between the very ancient, it's moving forward into 21st century, but also this advancements as far as technology?
We actually have had discussions with various cultures where they would use our technology and still would utilize the local in some cases, very non-traditional physicians that would come in, or non-traditional healthcare specialists. And I think it's a wonderful melding of technology and the old and the new brought together. We have projects in Iraq with the children. We have projects in Armenia with ophthalmology. We have the Orbis project, flying eye hospital around the world. But in each of those cases, they're bringing not only the new technology, they always bring the culture in, because that's an important aspect.
And we have about a 1-minute clip that we're going to show shortly about this, because this really shows the leading edge of what we're talking about. But I want to save that towards the end of this discussion, because Rose, I want to give you a chance to talk about it. We've discussed this before as far as going way back in history, but now it's just leaping into the 21st century as far as traditional care, but looking at this holistic mind, body, and spirit balance. How do you see that moving us forward in the 21st century that makes sense in light of all this technology and the computers and everything else?
Well, as I said before, 2 models have to integrate together. As a nation, we spend about 17 to 18% of our GDP on healthcare.
Yeah, it's trillions, you know, that's going into this.
$12 trillion that we spend on healthcare, but we're not getting any better quality of services. So we have to integrate prevention, wellness. The best way is not to go to see a doctor. And of course, if you do see a doctor...
Oh, that's almost sacrilege in this society. Particularly when you have all these advertisements on TV, you need this medicine, you got to go see this medical profession. And now you're saying, don't go see a doctor.
That's right. If we focus on prevention, focus on wellness, not only we're reducing the cost, we'll also improve the quality of life. And we're living to the 80s. And so lifespan is important, but quality of life is equally important. That's why we must integrate both conventional and alternative medicine into one body.
Well, I've heard, and this is something that's now being touted, the people that last 8 more years, that's 8 years from where we are right now, actually will be living over 100 years almost for sure, and maybe even into the 120s is going to become more and more the norm. And when I visited the Philippines, where Ace Doc is originally from, I went to Bontoc, and within a span of about 15 minutes, I met 4 people that were over 110 years of age. Wow. And could prove it. Because I thought, well, this is amazing, and it was just absolutely incredible. But I was using that for a purpose, Ace Doc, looking at as the life expectancy continues to expand, we have more people in these developing countries. How does that, what's it going to impact your medical missions, and how do we actually enhance medical missions to reach more of these people for quality of care?
Well, I need more funding.
Well, everybody says that, but we don't have more funding. So what's going to be the other side of that? Not just more funding.
The other side of it is what Rose just elaborated, that wellness, preventive medicine is the best medicine of all. If you can just educate people, especially in this country, where there's so much obesity, diabetes, and all that, those diseases that are the result of being obese. You know, it's unbelievable what we have to go through, and all the expenses involved. Eventually, if we prevent alone obesity, we can conquer a lot of other illnesses.
Yeah, and then that one goes to it. And Rose is eager to hop in here because I know she's in this prevention mode. Go ahead, Rose.
Not only that, Dr. Montero, we had the opportunity to do several medical missions together in the past decade. One of the philosophies that we adopted through the medical missions is we're going to teach the fishermen to fish, not just to give them fish. So based on that model and philosophy, every mission we do, we have 2 components. We teach the local doctors to better care through better technology, better education, so local doctors can care for more patients. And at the same time, of course, we offer free clinic to treat children, to treat people who cannot afford medicine. So that's definitely another model, another approach to help people to help themselves.
Well, I want to go back to Ace Doc, and I'm holding you off for it for a purpose because I want to get that video clip, and we're going to do that. But this whole thing, as far as wellness concerned, exercise, but also using the traditional foods in all these countries. If you look around the globe, it doesn't matter whether it's Mongolia, South Africa, the Philippines, Denmark, their foods, if you look at them, are well balanced for the climate and for the people there. How do we work this into the medical mission so that people are learning about how to have the best diets and not just depend on sugars, highly refined foods, and the other things that are adding to obesity?
That's why medical mission teams should involve people like Rose, because education is critical in these teams to educate the local populace. And if we can do that, not only that we have successful operations, successful treatment through pills, we can, again, the whole body concept that she's talking about, mind and spirit.
It's very important.
Yeah.
Let's see if we can have this. Let's roll the video if we can. And I want to get Rick back in here as far as the advanced technologies. If the video's ready to go, let's have it.
So I can describe this.
Absolutely. Go ahead.
Yeah. So what we're seeing is a floating clinic, basically, that'll be utilized in Lake Tanganyika. And this has mission capabilities throughout the world. Anywhere that we have island nations and you need a higher level of care, surgery can be performed. In many cases, lives are lost for minimal lack of procedures. And this is something that will solve those issues. We're reaching out. This unit has 2 ORs, it has an ICU, it has everything you'd expect in a hospital.
Oh, our operating rooms, intensive care for those that are not medically inclined. Okay. And looking at this is something that's just absolutely amazing because either you have large lakes, you have access to the oceans and those areas, and so this actually may be the platform of the future more so than just on-ground types of facilities.
I think we have to think much more broadly, and I think that's part of what we've designed these unique solution sets, whether it be by air, whether it be through a ship-based or truck-mounted. It really makes a difference. We've got a solution to meet the outreach needs of the countries that we serve.
And to use whatever resources they have. Rose, you're sitting over here and vibrating, so hop in.
Oh, I think it's a wonderful concept because we do lots of medical missions internationally. I can think of national crisis and remote areas. And also you talk so much about quality because when you travel around the world, you can see the quality of care. And we, in that sense, we still, as far as technology and quality, this nation leads the world. And using that mobile technology, and also I know you have the training component too.
Oh, yes.
So I think it's a great, really, education throughout the nation. Also treat, of course, patients very quickly, very convenient, and bring the medicine to the first line. I definitely think this is such an exciting technical advancement.
All right, we'll get Ace Doc in here. You only have about 15 seconds. You're the Don of this whole group. 15 seconds. Where are we going? Where are we going for the future medical missions and incorporating technology, alternative care?
We'll go as high as we can, as it will allow us to. If you involve 3 of us in every mission, yes, that's the future.
Well, that's really good. Rick, also, we're just letting the credits run right now, so just anything you'd like to share as far as MMIC?
I think it's a delight to be here, and our goal is to continue to reach out around the world and make that positive difference.
Well, thank all 3 of you for being with us, and thank you for joining us as we look around the globe to create the Emerald Planet.